First question on that to you, Dr. Chowdhury. What is the state of vaccine in India? There are a number of myths and there are facts. You have WhatsApp news and people forwarding stuff without even reading or understanding it. So perhaps maybe if you can talk about some of the key myths and please state the facts.
Yeah, I think that's very, very important. And that the initial poll was really important. I think it threw light on what WhatsApp University has been feeding most of us throughout the, more than what, not just them, even before the medical people knew what was happening, we were being told what was happening. So lots and lots of myths about vaccines. I think this is one area where we as Indians are really, really proud of what our country's done by way of vaccines. We know that lots of trials, on a lot of people need to happen before something is said that it is safe. But there are certain diseases where, risk of not being protected is outweighs, of the benefits of waiting for that to be safe enough. So therefore, these are emergency situations, and all the vaccines that were released in most of the countries were for emergency use, because this disease is a killer disease. And when we say that, the vaccines would not be released even if, if they were very, very dangerous for people. There are quite a number of near few thousand people that it would be checked upon before being labeled fit for use in humans. So that is one thing to remember. The important thing is that people know about 10, 15, 30 people having side effects, while not understanding that about 17, 18, 19 million people who've received the vaccine, of them, there are about 10, 15, 20 people who've had side effects. Now, if you were to take a population if these population were not given any vaccine, and you were to look at those side effects in that population, about 2 per 1,000 would be having those problems like, clots, etc. We'll discuss that later on. May happen. Just even if they didn't have the vaccine, it could just be a coincidence. So labeling it just as or attributing it to the vaccine is wrong. So, if it was that bad, big authorities, such big, people sitting up there who actually have been studying the vaccine, looking at its benefits and its risks, would not allow so many people to undergo it. And if you were to look at the medical professionals, most of us throughout the world have had both doses of vaccines so far. And how many deaths have you heard? So what you need to see is that we are the guinea pigs for you, who've taken it before you all have been given, even the high risk population. And there hasn't really been much about it. People are worried about that if I'm on a blood thinner, would it be really bad for me? So there's, again, not all blood thinners are a problem with the vaccine. And I think we can discuss that later on. The two vaccines that we have in our country, one is the Covishield vaccine, which is a vector-borne vaccine, and the other one is Covaxin, which is basically an inactivated virus. Both are quite safe, even in the immunocompromised patients. They do not cause occurrence of COVID when they are given to you. So that is one thing to remember, that will I get COVID if I take the vaccine? Absolutely wrong. Am I going to have a stroke if I have it? Not. That's a myth, not a fact. Am I going to bleed out? Am I going to have clots? Very, very, very little risk. And that too, whenever you go for a vaccine, you discuss with your doctor, and he or she outweighs the risks compared to the benefits, and then advises you whether you should go for it or not. So there's lots and lots to this, and I think I won't be able to cover it just with an impromptu extempore. Maybe we can come to the questions and I can answer them.
Yeah.